Today, everybody. This is Joe Moore coming at you with a brand new interview with Jake Mitchell of the Flight of Thoughts podcast. He's also very active in the Toronto psychedelic space, doing a lot of harm reduction and education. He's a paramedic and has a lot of training that many of us should probably also have. He actually does trainings around CPR, AED, first aid, mental health first aid, and more. A really, really fascinating guy, very active and passionate. I think you're going to dig it because we go all over the map. So let us know what you think. Hit us up at Psychedelics Today, email@gmail.com if you have any feedback, or join us over on Facebook at the Psychedelics Today group. So just type in Psychedelics Today group and you'll find it, and we'll add you. You have to apply. You just really click I want to join and you'll get in there, and it would be great to have you. If you want to support the show, leave us a review over on Facebook or iTunes. It only takes a moment, and we would really appreciate it. Really, the best thing you could do is to tell a friend about the show. Maybe there was an episode that you really liked, and you could share that with them. Maybe it's up their alley more than yours, and you share that episode with them. Either way, we would really appreciate you spreading the word or leaving us some kind words on Instagram or Facebook. If you're up for some expanded education, you can check out our class Navigating Psychedelics over at psychedelicstoday.com or psychedelicstoday.teachable.com. We'd love to have you dig into our Navigating Psychedelics course. It covers really everything you need to get a great rounded out intro. It helps people with lots of experience maybe fill in some gaps that they might have missed through the years of living in psychedelia, and newcomers also. It's really accessible. It's really designed for you. But it's what would you want? It's really what we wanted at age 16, 18 as a complete package of education and safety. We probably would have wasted a lot less time if we had this class. So, if you're in college and you want to be safer with you and your friends, maybe this is something you do. Maybe if you're a party person going to a lot of Spangle shows, you're on Spangle tour, or I don't know, whatever, and you want to do some harm reduction, maybe get educated, and you can be the one that's helping save everyone's life and keeping everybody safe. So it's worth it. We even talked to some folks about how to pick the right ayahuasca place in Peru or wherever you're going to go. I know all of you aren't going international all the time. And there's domestic situations too, and we also provide you with some tools there. So check it out. Again, Navigating Psychedelics, psychedelicstoday.com. On December 15th, I've got a breathwork workshop coming up in Breckenridge, Colorado. Again, December 15th, Breckenridge, Colorado. Full day transpersonal breathwork workshop. We totally empty, so if you're looking to fill it up with 16 people, come on out. We'd also like individuals too. So this is the format Kyle and I were trained in. It is Stan Groff's method. Other places call the method we use holotropic breathwork. We call it transpersonal breathwork, coming right out of Lenny and Elizabeth Gibson's playbook. So I think if you've been listening to us for a while, maybe it's time to try breathwork. Maybe come to beautiful Breckenridge, Colorado, high in the Rockies of Colorado, and I think you'll enjoy it. It's a pretty amazing technique, and I've been doing it since 2003 and couldn't imagine my life without it. So check it out, Breckenridge Breathwork, breckbreath.com, BRECK, breath.com. Facebook, Google, look it up, you'll find it. And if you have any questions, hit us up. Psychedelics Today, email@gmail.com. That's it for this intro. We'll see you on the other side. Enjoy the show. Ladies and gentlemen, welcome back to Psychedelics Today. Today on the show, we have Jake Mitchell. Jake spent 4 years recently as a paramedic in Canada and is now digging deeper into education around mental health and how to possibly bring psychedelic awareness and better practices around psychedelics into the first responder space. Jake, thanks for joining us.
Thank you guys for having me. I love the show, and I'm happy to contribute to the content.
Happy to have you here as well. So I guess first question, what can you tell us a little bit about your, what got you interested in involved in this space?
So I had a bit of an interesting start to the career because I had major depression and didn't know it. And that's one of those things for males. We get a lot of things like pain and like physical pain and non-emotional symptoms, so we can overlook it. So when I was struggling with that, I was seeing more of it in my coworkers too, who didn't realize it. And things like post-traumatic stress disorder, where people have no idea sometimes that it's building up in them. And I started to find cannabis as a very useful tool for my depression. And you hear certain things about it making mental health worse, but because I was getting it regulated and I knew what strains I was using, it was really helpful. And I realized people just need to be educated. I then saw people in my own community, first responders, using things like psilocybin and MDMA off duty to heal from post-traumatic stress disorder. Some of them weren't even aware of the research. They just knew that it was helping and keeping them away from things like cocaine, like alcohol, and opiates, where there's a lot of that abuse in the healthcare community. So all that together just made me want to help people out and contribute and bring people away from seeing it as a criminal problem and that it can be a useful tool in healthcare.
That's fascinating. I mean, I guess it makes sense a lot of like maybe self-medicating, quote unquote, within like healthcare fields from like, I'm guessing for being a first responder, probably suffer a lot of vicarious trauma coming up to things where you're like, whoa. It's probably pretty intense. And I could see why people would maybe resort to opiates and whatnot.
What you said there is perfect on two levels, because when you see someone like a military veteran, you almost assume that they have trauma right away. With someone's been serving time, you okay, yeah, that guy's seen or her have seen something really horrible. I can respect that, and I can assume that maybe they're going to need treatment. But with first responders, we're assumed to have just been able to handle anything. You chose this job, so you can handle it. And we are trained very well to come across random scenes and assess things for what they are and try to hold our emotions at bay. But where the calls become difficult and cause PTSD are the ones that we're caught off guard. There are some where we think it's one problem and it ends up being something completely different. Like we go for someone who had a fall and we realize it was because the father threw the kid down the stairs. Or, we go for someone who was shot and we think, okay, they're shot in the head, they're going to be dead. But when we get there, they're still breathing. And, you go, oh shit, now I have to keep this person alive. And your thought was, I'm just going to have to put a sheet over them. So those types of things that would catch you off guard are the things that set you up for post-traumatic stress disorder. But when you see all the details that you're going to, it's less traumatizing because you can set your brain up for that approach circuit. But we all, veterans, nurses, anyone in the field, even healthcare, mental health workers, they take on trauma too. And people need to be aware that it's anyone's prone to it if we don't have the proper tools available to help ourselves.
Yeah, I was going to say the last place I worked at definitely have like vicarious trauma of just dealing with people in crisis all the time. I was telling a friend that I worked with, it's taken probably about like a year or so to just shake that experience off because it was just so intense. And I didn't realize like later on like how much it like kind of screwed up my nervous system, just kind of always being on guard, always like kind of watching over my shoulder. And it was just because that was the environment I was in for 12 hours a day for like 40 hours a week.
See, that should be another thing too, because there are layers of trauma and chronic trauma that we carry that may not qualify for PTSD all the time, but our nervous system has actually adjusted and permanently sometimes. So what you're talking about, that happens a lot with police officers and security guards, where they always have that edge to kind of spring to response. Firefighters as well, and even paramedics, where we're sitting at a base waiting, and then the bells go off, and you have to jump up and respond. Nurses and even yourself, maybe if you're working in crisis, when that patient turns all of a sudden, and you have to now switch to this defensive mode and try to de-escalate, your nervous system has this adjustment. Like when we used to run from tigers, a tiger would jump out and chase the tribe and you'd be like, shit, got to remember that. So your brain locks that in there. So now you might then, if that happens long enough or so many times, you might wake up at night to that feeling. And, you might not have a hallucination or a memory of the specific incident, but your heart might race. And that's a layer right there.
So like, I don't know, I guess percentage wise, what was like the percentage of paramedics that you saw using MDMA or psilocybin? Like, Yeah, that's pretty interesting.
And it's interesting because a lot are going to do it very under the surface. And then because, as you know, if one person finds out, it's very hard for people to keep things quiet. People have conversations with each other, especially if something's so groundbreaking, when someone has such a big experience and they share it, someone might take that as, I better tell a supervisor about that. I don't want to work with that guy. It's the incorrect stigma, right, that we put on those things. But from what I've seen, if I put cannabis in there as well in the category, it's almost most people are using cannabis. But with psychedelics, man, that's a tough one. A quarter that I know about that are open about it, that have said, in the last couple of years, I've tried psilocybin, LSD, I've tried, MDMA. So I would say like that, but I would like to see a really good, honest survey. And I imagine it's much higher. Nurses are known to be at those festivals, Coachella and stuff. A lot of nurses are there because they have, I don't know why, but they have more of a community that they're able to band together and enjoy those together. Yeah.
There was a nurse that when I was growing up being a lifeguard, there was a nurse working at my pool, and she'd always ask me about LSD. She'd see me reading these books. And it was like one of those drugs she just didn't get drug tested with. So she was like, how do I use this? So she was like asking me like early on, like, yeah, how do I use this? What's a good set and setting? And
so that's the
funny.
Well, the cool thing too is they passed a new law here with cannabis for police officers only. So I wonder where this is going to go, that if any police officer uses cannabis, even just before their shift, as long as they are fit for duty, they aren't going to be scrutinized.
I think there was something about armed services too, like Army guys too.
Yes.
Like, it's fascinating.
And then hopefully that translates to all workers, because in places like Colorado, we've seen drops of workplace injuries. We've seen drops in mental health problems at work. And it's not because people are high at work. I think we can all be honest. No one gets super stoned on a crisis floor or on a surgical unit and then goes, or, in a fire hall and then goes out and responds to a call. It's people using it, when they're off duty to relax and, settle their body. And then an hour or two later, when the THC's died off in the system, everyone's tolerance is different. So I think that we can respect that some people can use 3 hours before a night shift and be fit to respond. Some people have to wait a day, right? So
I've goofy, but we'll just cut it really quick. I've seen nurses on call just hanging out, like smoking weed, and also like doing nitrous oxide.
Yes.
Because it wears off so quickly. It's like, yeah, whatever, I'll be sober. I could still drive in 10 minutes because it's such a short half-life on this thing. It's fascinating. So
it is
interesting, and it'll be curious to see how this develops for sure.
Also, the amount of illicit drugs that healthcare workers are using on duty, like cocaine, like alcohol, that's massive. I've had partners, and I will never sell someone under the bus, so I would never say a name or anything ever. But I've had a partner to be on a medication that's prescribed to them for pain that they were intoxicated on, and I've had people who've been on alcohol. When you start as a paramedic, you don't have a partner that's steady, so you work with a bunch of different people. So you have a chance to see like 100 different paramedics in their own skin, and once in a while, you'll come across one who has that bit of a look to their eyes, and we're trained to look at that stuff, right? So you can see it in your partner. Or a little bit of a whiff of pot from somebody who may have smoked on the way in, which, is risky in my opinion. I think you're not going to smoke in uniform and have the smell on you. But, there's times where you see that. So it's out there. So if we regulate things like cannabis and say, if you use it at home and show it fit to respond, we won't scrutinize you. That's almost like a no-brainer. Okay, I'll just wait till I'm not at work. That's it. Use CBD at work.
Yes, absolutely. Absolutely. If you need to use something, try something non-psychoactive that just like chills you out a bunch. I would love to know what that response is. Something with the parasympathetic nervous system just becoming more available or something. How would you guys phrase that with CBD?
So CBD, what we do know is it counteracts the effects of THC. So THC is this CB1 receptors CBD is the CB2 receptors. And yeah, you're right. I think the THC is predominantly in the central nervous system, and the CB2 receptors are more in the immune system and the peripheral. Yeah, like you were saying, peripheral nervous system. So what it'll do, it's similar to Advil. So if you ever have someone who's taken too many edibles, or they're too high, they can take Advil and actually counter the THC similarly. It's been shown.
Really?
Yeah, I forget what study I read that in, but it's also, I've heard it anecdotally, because it works similar to CBD. So taking CBD if you feel too high is actually a really good practice if you have good source of oil. Holding it under the tongue for 30 seconds and then swallowing it would work. So
yeah, I'm seeing a bunch of 2013 articles on that. That's great.
Yeah.
Good call.
Yeah. Well, yeah, it's knowing what works, and it's good to have a little kit in case, you have a friend who's trying it for their first time. Have you guys had any experiences with any friends trying cannabis their first time that went awry for them?
Oh, for sure. It went awry for me a bunch of times, for sure. Yeah.
That first year or two when you're trying, right? You make those little mistakes. Those like, well, I think this half a joint was fine, but I don't quite feel it yet, so I'm going to finish it. But you know very well that the last time you only needed half, right? So
right. I'm a slow learner. I'm sure a lot of us out there are slow learners. But
the first time my first time was an edible. I had no idea what the hell I was getting myself into, and it was terrifying. It lasted for over like 24 hours. I was texting my friends like, how long does this last? And people are like, I don't know, like 3 hours, 5 hours maybe. Like I'm going on 24. What's going on?
Well, edibles for your first time, I would always say that's a no. Not right now.
I was naive and dumb back then.
But then again, that's the one that used to be sold out as like the, hey man, you want to have a good night, take a brownie. And no one really said that you should try smoking first. It just there's no harm reduction. So that's why doing things what you guys are doing, a bunch of us are trying to do harm reduction workshops for cannabis and psychedelics so people don't make these mistakes. And the good area about this is there is no one who can say that people are promoting anything illegal. All we're doing is preventing harm and preventing people from ending up in emergency rooms for no reason. It's a waste of resources, and we all know it.
Yeah. Well, let's dive into that a little bit. Like, what have you been up to? I know you've been doing stuff for this Toronto Psychedelic Society, and you've been leading these harm reduction workshops and some mental health first aid, and you're trained in CPR. So, it sounds like you're doing some really cool stuff up there and getting, a lot of this info out for people in the Toronto area. So
we're trying to really prevent harm. The issue we're seeing, though, is when we're trying to promote these workshops on social media, they're not approving the ads. They're trying to say that we're promoting illegal drugs when the description ever says is harm reduction, teaching people how to respond to overdose, teaching people how to recognize overdose. There's nowhere in there where it's saying teaching people how to take MDMA. It doesn't say that anywhere. But you know how the algorithms work, right? I tell people if you are getting these non-approval things, appeal them, because sometimes it is just an algorithm. And if you explain your case to them that you're just a harm reduction workshop, they can sometimes reverse it. But what we're doing is we're teaching people about testing kits. We're teaching people about how to recognize when something's laced, how to know when to call an ambulance, and also the first aid steps that you could take with your friend to know whether you need to call that ambulance or if you getting them to breathe and work through it will be enough. So I guess what I'll quickly just say is the main things that we want to get across to people is know your substances. And if you know that it could possibly be laced or from someone you're not aware of, get a testing kit. They're available now at vape stores. They're available online at dancesafe.org. I think the Bunk Police have these reagent kits. And what they'll do is you'll at least know exactly what the substance is, so your friends or yourself will not be hurt. Also have a safety plan, like a breathing technique that you know works. The best one, if someone's hitting a really bad panic, or as they say in Fear and Loathing in Las Vegas, he says, I think I'm feeling the fear. If you feel that fear coming on, there is a perfect breathing technique. You take 4-second breath through your nose, hold it in a little bit, 4 seconds out your mouth, like you're taking a bit of a bong hit, right? But through your nose. So 4 seconds in, hold it, 4 seconds out. If you can get that person to take about 5 of them, get them to take 7-second breath in their nose and 7-second breaths out their mouth. Now our brain, it recognizes if you can get a 7-second breath in and 7 seconds out, that you're not running from any type of predator. So it shuts off the fight or flight response, and it kind of helps with regulating oxygen. So if you can get someone to control that breathing deep and slow, give them something physical to watch, like show them with your hands, put their hands on your hands and raise them up. Tell them to imagine an elevator when they're taking their breath inside of them. Just get them away just to focus on it only. Turn off loud sounds, turn off lights. And once you've identified that, look, they're just on a clean substance and they're having a difficult time, you can just guide them through, or not guide them, sorry, but support them through it. And if you think at any point that it is laced with something dangerous, like fentanyl or an opiate or a really powerful stimulant, then definitely you're going to want to call an ambulance at that point if they're starting to show signs of physical distress. Have you guys ever had a time where you knew somebody who needed to call an ambulance because they had something laced and it started to hurt them physically?
I've not seen it myself. I've definitely seen people around me at festivals just fall down. If I just a few weeks ago saw some seizures at some shows I was at, ostensibly from drugs, but never anybody that's with me.
Okay, so let's talk about that right there. That's perfect. So the way to know that someone actually is overdosing on something dangerous and needs help is if they are unresponsive and you can't wake them up. Two tricks you can do: take your knuckles, rub their sternum really hard in the middle of their chest as hard as you can, and scream at them their name. Yell at them to try to wake them up like that. Shake their shoulders, and you could also squeeze their trap muscle, so that muscle that connects our shoulder to our neck. Squeeze that as hard as you can on them. And if they don't wake up to that pain and you yelling at them, and they're starting to change skin color, maybe they're going pale, their pupils could be changing to really huge or really tiny. They could be really sweaty or really dry. If anything like that's changing on them and you can't wake them up, then call the ambulance and roll them on their side. You can Google the recovery position. It's really easy. It's just tilting them on their side so their airway's open. So if they puke won't go down their lungs and they can breathe. Because the biggest thing that kills people when they're unconscious is lying on their back and the tongue dropping back. So even just tilting their chin up, if you can you push down on their forehead and tilt up the chin, and you hear that the gurgling stops as someone's choking, you'll hear them start to take good breaths. That's how you know you've opened their airway. And just roll them on their side and watch their breathing. If anybody stops breathing and starts to turn blue and their chest stops moving, then you're going to have to start chest compressions. If you have Narcan, though, and you understand how to use Narcan, you think it's an opioid, then administer the Narcan first. Wait 1 to 2 minutes and administer the second dose. If that doesn't work, start CPR. And call an ambulance first before you start CPR, because if you're doing chest compressions, you can't stop. So as soon as you think your friend needs it, there is a point where you have to kind of drop that ego and know, but it should be quite obvious. You're not able to wake them up. Their skin's changing color, all that stuff. If, though, they're just freaking out psychologically and they're awake, all you have to do is try to seat them down in a quiet space and ask them how you can help them. That's the one thing people forget to do. Just ask the person, what can I do for you? They might tell you, just go for a walk with me. Perfect. Let's do that. Oh, just give me some crackers. Okay, let's do that. Anything within reason, and set boundaries. So another thing too, if someone's being unreasonable or they're in a mania or a psychosis, give them alternative options for things. So you're still in control, but you're making it seem like they're in control. So do you want to have a seat on the bench or on the floor? Either way, they're going to take a seat. Do you want to go outside or do you want to go to the parking lot? So that way you're getting them away from the music either way, but they're able to choose the location. So those are the things I wanted to say is make sure you know the signs. Take a first aid course. Take a CPR course. And mental health first aid as well. They're available in all over North America. So, and also first responders too, just being easy on people, right? When you're responding to these, these volunteers at festivals have told me at times they've had some really bad experiences with paramedics and cops belittling them and being belligerent. So be easy on people and know that it's not that these are bad people. Everyone experiments with substances. It could be caffeine, right? Like all of us do. So let's not be judgmental.
Thanks for that. That was a lot of really great information. I'm wondering too, if somebody is if it's to the point of serious threat to their life, would they even be freaking out, knowing that they're overdosing and kind of having that verbal reaction, or would it be just more like physical manifestations that you would need to look for? I mean, maybe early on, if they feel something's totally off, they would say it's something, but I don't know.
There's a really cool tip I have for that, because when we all know if you take a certain dose of psychedelics, and some people will have moments where they feel that rising in their chest, that impending doom. In a heart attack, that's actually one of the symptoms you look for as a first responder or a doctor or a nurse, is that feeling of, oh shit, I'm going to die. And then what happens sometimes when someone takes a psychedelic is they look at you go, oh fuck, I'm going to die. So it's knowing, you can't rule that out because none of us are doctors, but remembering again, if you know the substance. So if you tested it, your LSD, or you knew what mushroom you had, and, you don't have a reason to believe they should be having physical reaction, because LSD and psilocybin don't have cardiac effects. They don't have, they don't shut off breathing. MDMA is the one where you got to be careful about neurotoxicity of taking like hundreds and hundreds of milligrams of it. But no one typically does that. I think the typical dose is like 100 milligrams or something. Like, I'm not sure, but, if you test your substances and know your dose, you should be able to get away from that stuff. There's no excuse almost to not test your substance, I find, if you have access to the kits. Mm-hmm. It's just like cannabis, you don't have to be as worried because it's not as laced as prevalently, but even LSD sometimes can have fentanyl. Testing strips for $2, I think, if you get them online. Mm-hmm. So get yourself a pack if you feel like you might be at risk. But yeah, I think it's very good to know that stuff.
If you buy 100, Dance Safe brings the price down to $1 per strip.
Perfect. See,
so good to
that's
know.
The thing. Yeah, and also with their kits, they sell them in deals as well.
Right.
So yeah, even if you have a friend who uses something, then you can get a testing kit to help them out. Maybe you have a boyfriend or girlfriend or something, and you're worried about them getting something that might be laced, then get this for them. If they're just saying it's too inconvenient to wait for it in the mail and all that, get it for them as a gift. I mean, so that's for things like LSD, cocaine, MDMA, anything that's kind of not cannabis, I guess, or a mushroom that you could just look at and tell what it is. That's it. And just be careful with it. But they're easy to use. They're very easy. The instructions are online. Mm-hmm. I wish they had them in ambulances and in the ERs, but of course that's harm reduction, right? And some people view harm reduction as a rogue practice. So it's unfortunate.
I was just actually reading a chapter in my substance abuse course today about philosophical theories of substance abuse, and you have the recovery model and then the harm reduction model, and just how, the harm reduction model is controversial in America. We're very disease model oriented and really just try to push abstinence among people. I thought that was really interesting to read about that. Yeah, harm reduction is kind of like this controversial kind of taboo model, but I mean...
Well, the big thing that we get in trouble with is when I was working, I'd tell patients a lot if they were on opiates and they were struggling with them with bowel issues, or maybe they had an overdose, or they felt they're getting dependent. I'd ask them casually, sometimes with my partner even beside me, have you tried cannabis? And depending who my partner was, they might go, what? Until one day I had a supervisor ask before I got a chance to. They leaned over my shoulder and said, have you tried cannabis for this pain? And I went, wow, things are changing. And I'm never afraid to say to someone on an opioid, which by the way is heroin, diacetylmorphine is diacetylmorphine. So if you're somebody who's on an opioid and you think, well, those people who shoot up heroin, oh God, I can't believe they do that. Well, you're on the same thing, except yours is 5 times stronger if theirs is pure, just so you know. The only reason people typically overdose on heroin is because it's laced with different doses of pharmaceuticals. So when I see someone who's using this prescribed, I always ask, try cannabis first. That should be the first line. It's got such a big safety profile. If it doesn't work for you, you could stop suddenly and not worry about side effects. And if it doesn't work, then you can go ahead and try other things. Another thing I wanted to say is Advil and Tylenol works the same as opioids. So if you are somebody who thinks you need opioids, try Advil and Tylenol first. The only difference is that it doesn't get you high. So if you feel that you needed morphine or something instead, then maybe your problem isn't physical pain, maybe it's trauma. Sometimes we have emotional trauma and it comes out as physical pain. That's why most people get addicted. Yeah. So try cannabis first. I was never afraid to say it, but I really hated how some of my partners would criticize after and say, I can't believe you'd suggest them try cannabis instead of heroin. It's like, I don't know. I remember even too, like not having it on the ambulance. Why can't we have like a spray of like a balanced CBD THC? I remember us pushing morphine on a 13-year-old with a broken arm and going, that's heroin. Like if, and the mom's okay with that, you know, they're giggling because she's slurring her words and telling her funny dreams. Right. And the parents think it's cute because it's a pharmaceutical, right? And that's given in a healthcare setting. But then they see the person on the street who's using that same drug and they go, I can't believe they chose to take that drug. It's like, you just gave your daughter that drug for her broken arm. So
Drug
harm
chauvinism.
reduction, yeah, exactly. And that's what harm reduction is realizing substances are confusing. People are going to use different ones ignorantly and sometimes just naively or pushed by a doctor. So let's teach people what each one does, and then they can choose for themselves whether they feel it'll work for them.
Yeah. One of the main concerns, there's two concerns. I forget what the first one was of the harm reduction model, but the second concern that I read about today was legalization. You know, if you preach harm reduction, it kind of orients towards legalization eventually, or maybe decriminalization. I mean, I guess you see that in Portugal and what you saw in like Amsterdam and whatnot, that, yeah, once you start doing these harm reduction things, you kind of start viewing substances a little bit differently. And I think that's really scary for people in the States to be like, wow, yeah.
Well, let's see. Like, it's better to see it as a public health problem. And you're right. The stats show that it supports, that saves more lives. More people seek help when they're looked at as a someone who's suffering than someone who's, you know, breaking the law. And when I worked in Moss Park, I volunteered at that supervised injection site, and the people were so willing to talk about their traumas to us, to the nurses and other healthcare providers who are there, and trusted us with, you know, pointing them in the right direction. And sometimes it was things like someone who was Indigenous, you know, a First Nations member who just was told their whole life that talking to an elder was bullshit. And all they needed to know was, guess what? That would work for you if you felt it would, and you should go and try to talk to your elder. And then just hearing that from someone in a grassroots setting, it's more personal. And, you know, there were some people who came back and said, look, man, I'm going to go and try to talk to a counselor because I didn't know that I could go and do it non-judgmentally. So we're trying just to keep people alive. And that site alone in 3 months reversed 96 overdoses.
Wow.
And those are 96 people who would have died, and funeral homes would have been piled up, first responders, these families would have lost somebody, and those people would never have been able to have a chance to get better. So, yeah. I hope Narcan becomes free for you guys in the States like it has for us. What's the dose? What's it cost now to get Narcan for you guys?
I'll pull it
Not too
up.
sure off the top of my head.
There are a number of organizations putting it out for really cheap, between 20 and 40 US for a full naloxone kit, which is probably only one dose, right?
Did you say 420? Sorry, I missed that.
No. Sorry, 20 to 40.
Oh, okay.
An overdose death. So let's put it in terms Republicans can understand. It costs $30,000 to deal with an overdose death, or $20 or $40 to reverse the overdose.
I love that.
Yeah, you know, before the professionals get involved. As soon as pros get involved, there's obviously costs that have to be run through, but it's certainly less than a death.
Also, how many doses do you need? If it's fentanyl, you might need 3 to 4 doses.
Absolutely.
You know, and how many people are going to think to buy that, like 2 or 3? But pharmacies here in Canada will supply you with 2 doses, and they'll say, do you want the nasal or injectable? What are you comfortable with? And the pharmacist will train you right here.
Wow.
So if you're a Canadian who has anyone that you know that is using opioids or is at risk, this even includes someone who came home from a surgery and is prescribed Dilaudid or OxyContin by the doctor. Because I've been called to those sometimes where that person took a little too much extra. They took 2 extra pills or something and they stop breathing or they can't wake them up. So just remember, you can respond with Narcan. It's so easy. So you can look online. There's instructional videos and let the pharmacist teach you. I really hope you guys can catch up with that too there. And same with supervised consumption sites and harm reduction. I would like to see more of that in the States too. You know?
Absolutely. That's a hot button issue in the psychedelic world because everybody has this concept of psychedelics being perfect and every other drug being evil. And that's a gross overgeneralization. So sorry, trigger warning, retroactive. But drug issues can't be dealt with in single drug format. We have to deal with them all, unfortunately. But let's take an approach, say, like, how do we reduce harms for all these things? Let's, figure out how to get them more into the mainstream and manufactured more safely. And then as a result, people will know what they're eating more. It's not such a fucking grab bag with MDMA anymore because nobody knows what they're eating. Like, it's pretty common that people are just eating garbage chemicals and, feeling high as a result. Like, but that said, having a standard product would be so much better for everybody, including healthcare professionals. Like, how many pills?
Because we know what to expect. Yeah. Well, it's like what we have now. If someone parties with a pharmaceutical, if someone says, "Oh, I took the allotted," how many? 2. What pill? 4 milligram pill. Okay, you're on 8 milligrams. Perfect. I know exactly what to expect. So if the same thing with MDMA, which, by the way, there is a way to know by looking at someone if it could be laced with something that's not pure MDMA. If someone's chewing repeatedly, the grinding of the teeth too much and chewing, that's called bruxism. And usually that's a sign of speed or amphetamines being laced into it. MDMA is not supposed to be really speedy. It's an empathogen. So yeah, it's normal to be hyper and energetic and stimulated on it for people, but they shouldn't be like they're on cocaine. Some people really do look like they're on cocaine when they're on MDMA because it's laced. So that's another thing too. If you another sign that you may not have a pure substance. But yeah, I'm glad you guys bring that up. I think decriminalization, at least, saying legalization, I'm not sure exactly what that would entail for how they would produce it and stuff. But I mean, for decriminalization, keeping people to be seen as a patient and not as a criminal is what I would like to see. So that police officers and paramedics and nurses and doctors can work together in the emergency setting for that person who maybe is overdosing on meth or something like that, and try to keep them alive as a person and not look at, well, who's going to charge them now for that meth possession? But we do have a change in our Good Samaritan Act in Canada that if you have minor possession of a substance and you don't have a trafficable amount and you've called an ambulance for an overdose or for someone on a drug, you will not be searched and charged for that minor substance. That's the new change here in Canada. So look for it in each province to see if there's any changes in your province. But in Ontario, at least, I'm very comfortable to say that if you have a minor possession, the police are not allowed to charge you on that if you've called for an overdose.
Huh.
Yeah.
That's actually an interesting segue into like human, pause, interactions with police from normal folks who may or may not be high, like, or just in general. Like, this drug war thing, unfortunately, has eroded a lot of our trust in the law enforcement system and our willingness to engage with them. I know personally that's been the case for me. I know police officers that I like, but I'm sure they've done stuff that I would, be pretty troubled by in a lot of cases. But, who owns that responsibility of repairing the relationship between the public and law enforcement? I would love to dig into that eventually.
Yeah, it's a tough one. I think training's a big issue too. Police don't have extra training around substances and mental health problems. A lot of the times you're lucky by whether that cop has extra family experience. Maybe they have a family member with schizophrenia or with an addiction to something. And when they respond to that person, they do treat them different. But I've been there too, where, we've almost been as paramedics protecting the person from the cop. And it's not that I want to put any police down that I've worked with, because they've been great where I've worked. I can't speak for every region, but in Halifax, they're fairly open-minded, and it's more of a community effort there. But there have been times where they've been belittling a patient, or they're poking too much about like what drug they're on, and not so much about the heart that's flapping at 200 beats per minute. And we've almost had to just say, look, we're going to take it from here and just throw them in the ambulance and run. Sometimes with drugs, if someone's on something like LSD or psilocybin, and I know it's not going to hurt them, but I see the police are starting to look down the road of, well, we might have to take them into the cells, I'll probably just say, like, look, I would feel more comfortable if I took them to the hospital, because maybe in case it's laced, the nurses might want to do some blood work, and and that way they don't go to jail. So that's another step of harm reduction. If you're out there and you're a paramedic who wants to change that, and you notice a police officer is looking at trying to charge someone for being on something like mushrooms or LSD, you might say, hey, look, I'm going to take them in for a physical assessment, and that way that person doesn't have to go to jail, right? Mm-hmm. So just point it down towards, this is a healthcare issue. This is not a crime issue. And same with mental health, right? That's why I'm trying to get into mobile crisis. I want to be able to be there with the police so I can take over if it's just a substance call, or if it's a call where someone's in psychosis. I've been to a couple where we've been lucky enough that we were there with the cops. We can all collaborate as a team. But the job of the police is safety, and their job is to make sure they're not a risk to themselves or others. So they don't have that extra bit of training when it's just two cops or one cop. To be able to handle the mental health problem and the weapon or something that's there. So when they have that secondary healthcare provider or mental health professional, and that could be you, Kyle. I mean, you would qualify for a mobile crisis position here in Toronto Police. They want someone who has a background in university mental health or nursing. So you'll be there behind the cops talking to the patient while the police are there protecting. So they'll have a taser or non-lethal force, and then there's a second cop who has the lethal force ready just in case. Unfortunately, there have been times where people have come at professionals with weapons and things happen, like deaths, but there have been times on streetcars in Toronto where people have died wrongfully. I don't know if you guys have heard of the Edmund Yu case back in 1995, where a guy was in psychosis. He was holding a hammer. He wasn't threatening anyone. He had a verbal altercation with somebody on the streetcar. They kicked everyone off. And without any threat or any movement to indicate he was going to harm them, the police opened fire and killed him. And he was just suffering from schizophrenia. Another one more recently was, I forget his last name, but it was Sam something. And he was shot on a streetcar in Toronto, and he was holding a pocket knife that was about the size of your thumb. He had told everybody, please get off the streetcar. I don't want to hurt anybody. I'm hearing these voices, and I don't want to hurt anybody. As he slowly approached the police officers, there was a whole bunch of them. They shot 8 times and basically killed them on the spot there. But if there was a mental health professional there, they could assess that patient and actually de-escalate them and prevent lethal force, if times than not. But we need more people who are passionate out there. So if you are a nurse or in the crisis field or mental health professional, see if maybe you can get involved with your police department and either training them, giving them extra courses they can take, or going out with them to calls if they allow it.
Mm-hmm. Yeah, actually, when I lived in Burlington, there were a few incidences where police shot people with mental health issues, and they actually responded with getting somebody that was trained in mental health, like crisis intervention, and had them on the team and bring them out just because of those situations arose. The community kind of, wanted the change, and I don't know how it's doing anymore since I moved away from there. But yeah, that was really cool that they incorporated that into their services, because it's an issue. Because I've definitely worked with calling the police when I worked in crisis a lot, and they would just come up and even though we're trying to maintain the mental health thing, they would just want to overstep and take over. And it's like, no, we need training. We need to work together to make sure this person's safe. And yeah, I think it just comes down to training and education.
You brought up something really good there too, because there's this one call in particular. I remember it was 4 a.m. This poor woman was in a bit of a psychosis. She had smoked some cannabis that night, which the new studies have shown that actually people with schizophrenia, it's not that cannabis has caused it, it's that they had already had prodromal symptoms of schizophrenia, and the cannabis actually is helping them relieve some of those symptoms. This is a new study done with 23andMe, that gene, that genetic company. Over 180,000 genes were assessed, and they found that out of all those people, it was more that they had the gene for schizophrenia, not that cannabis caused it, and that they were using it to help with their prodrome symptoms of feeling isolated, depressed, or anxious and paranoid. So it can worsen with things like high THC, but people who are using lower THC levels, higher CBD, it was actually helping them a lot. So that's another bit of harm reduction. If someone does have bipolar or schizophrenia and you know that they're using cannabis, be very, very diligent on telling them about the benefits of CBD and lower THC, because with the psychosis, this THC is pushing them further into what we call a positive entropy, where they don't want all those extra symptoms. So CBD will balance them out more. It's just interesting how that works. Mm-hmm. Yeah, so that's good to know that with like, sorry, I forget where we were getting at with the schizophrenia. I feel like I went off there a bit.
Just like crisis intervention and...
Yes, we need more of it, and Canada's doing a decent job with it, but we need more services available, and we need more 24-hour available because the hours are limited. So I'd like to see that too.
Yeah, that would be good. Can you... It's kind of a specific question, but have you seen serotonin toxicity before, and what can you describe it at all?
Oh wow, I can't believe it. I didn't know if this would come up, and I completely forgot about it. But yeah, I've seen it a few times. I've been clipped in the jaw by somebody on PCP from it. It was okay. It was a very minor graze. The police officer didn't take it very lightly, though. Delivered a few elbows to the patient. I had to kind of like, I was a student, right? So at the time, they took it very like defensively for me. But then the next time I seen it was when we were responding to a guy who was wearing underwear in minus 10-degree weather in the snow, punching cars that were driving by at 60 kilometers an hour.
Oh, no.
So I guess in miles, that would be how many miles per hour? Try to translate it for your American
60
listeners.
60 kilometers?
Yeah.
Let's see.
Oh, shit. That wasn't ready for this math.
That's 37 miles an hour. That's way too fast to be punching cars.
Yeah, so he was punching and kicking cars that were driving by at 37 miles per hour, covered in sweat in the snow. So when the police got there, he was wrestling naked with his friend, who was also high on the same drug. They were snorting what's called Wellbutrin. Right. So it's an antidepressant that works as a stimulant when it's snorted, and it boosts serotonin. So they had both entered a excited serotonin state. The friend took off running, and the police had to hold down this other guy who started punching at them. And you ever seen the movie Dawn of the Dead, the new remake? And 28 Days Later and all those types of running zombie movies. That's how I would describe someone in excited serotonin syndrome who's aggressive, is they seem like one of those zombies that are running around thrashing and gnashing their teeth and screaming. And when my partner and I got there, it was 6 police officers holding him down, and he fought them all off. We had to run, slam the door, call for backup. My partners came who are advanced care. They could deliver Versed and actually sedated him. So put him unconscious so we can get him on the stretcher and get him to the hospital, because serotonin syndrome is dangerous. And people have died in that. It can jack up the heart rate and cause dysrhythmias that are lethal. It could stop the breathing. And it could also cause police officers to have to use more force than they want for safety. Mm-hmm. They may have to taser somebody more or longer than they want to subdue them. And they may have not wanted to have to use that force, but if they're in danger because he's fighting off 6 cops and he can get one of their guns, they're going to have to hold them down harder. And that's where some people might stop breathing, or their heart can enter into like a supraventricular tachycardia for your healthcare people listening, or and they can die from that. So if we can do things like ketamine now, we're seeing in the emergency room, ketamine's able to take people out of that state and K-hole them almost and dissociate them so that the team can then work and try to put in fluids to dilute the drug. So that's another thing there. Yeah, we're seeing ketamine be used more in emergency rooms for that. So that was the one where we saw it, and the guy could have easily been harmed, or he could have harmed one of us, but we were able to sedate him enough to get him to the hospital in time.
Is that a normal response for serotonin syndrome, of getting like, a lot of energy and something? It sounds like PCP a little bit.
Yeah, well, Wellbutrin I feel had the similar effects to PCP. It's when it's abused. When it's taken in small doses, it's called Zyban as well on the market. It's for anti-smoking and antidepressant. It works both ways somehow. But it boosts serotonin like crazy. So yeah, PCP and that can have a similar response. But those are drugs that if harm reduction were in place, people would be more educated on, because PCP was also used as a dissociative in medicine for a while, wasn't it? That's how it was discovered. It was used as a surgical tool to sedate people and dissociate them during surgery. But in high doses, PCP jacks things up and puts you into opposite. Like all these drugs, every single drug that's illegal has been used. Like cocaine was used for surgery, and then doctors decided, it feels pretty fucking good to snort it too. So, and then they had to cut down on that. But
yeah, that's fascinating. I hear from stories that serotonin syndrome feels really bad if you're not in kind of like a super wildly high state. Like PCP, I think if you had it under MDMA, it would be a lot more painful, probably.
Maybe.
Yeah, but it's hard saying.
Well, we need more information, I think, on what dose per body weight causes it, and how it. I guess also too the serotonin receptors are in the brain, right? So it's not so much body weight; it's also it might just be the dose itself, right? Because metabolism is a factor there. I'm wondering if we could do some research one day to figure out if there is a safe dose that can prevent it. We know in research with MAPS, they're using, 125 milligrams in the doses, which are really safe a profile we're seeing when clean and pure. What doses do you guys think have been causing it? Do you know the dose, or is these people who have unknown doses?
I would say unknown doses, man, because anything black market and pressed pills, you're never going to really know the dose. You have to trust somebody. You could do analysis to get that, figured out, but that's expensive. I'm seeing an increase in just bags of white MDMA, and people aren't really measuring it out fully. So they're just like licking their finger, dipping it, eating it, and, as they see fit. But I see some people very lightly going that way, like 1 or 2 for a full evening, which is probably, 30 to 70 milligrams, maybe. That's very rough math. But I'm seeing some folks, man, like probably doing 500 milligrams or more in an evening.
Wow.
I'm wondering if it's 500.
Heavy users,
I don't know.
Very heavy.
Yeah, we
users.
don't have much research on that. We do know there is a neurotoxicity with MDMA. It's one of the psychedelics or empathogens, whichever. Some people are very picky with what you call MDMA, right, in the psychedelic community. So I don't want to offend anyone out there, but the way it works is it does have a level of neurotoxicity. I would like to read more of the research on what doses they found that it's causing effects on the brain like that. But I'm wondering if maybe it's causing permanent changes to some people's serotonin systems over time if they're abusing it.
My thought is it's not permanent, but persistent.
Right.
So like a year or 2 or maybe 5 years until they return to baseline. We talked to Emmanuel Sferios, from the founder of Dance Safe, recently. He was saying the number one harm from regular use or abuse of MDMA is that you might not get high from it anymore. That's the number one risk.
Good. That's good.
Permanent neurotoxicity, not so much. That he's trying to move away from the term harm reduction to risk reduction, because he's like, it's not harmful. It's just kind of there can be risks.
It's like cannabis, I guess, in that sense, where it can cause certain changes to your lifestyle and the way you perceive things, and it's nice to kind of just keep that regulated, and that's like tolerance breaks, right? So any substance, people should be having tolerance breaks. I think a couple days off, even microdosing. James Fadiman's research, I think, showed that cycling was more beneficial than every day taking it. So I think with any substance, it's good to have that. Like coffee, that's the one substance I'm kind of screwed with because it's socially acceptable. We were laughing about this in my addictions class the other day, that in an AA meeting, you can go there for almost any substance, but you can't go for caffeine because they start every meeting with a big pot of coffee. So
some donuts.
And donuts. So yeah, you can't go for obesity or diabetes. That's another fun one. Telling people when I teach first aid that type 2 diabetes, type 2 specifically, is a symptom of sugar addiction. That's, if you guys want to put someone's foot in their mouth who's trying to tell you that addiction's a choice and that these addicts out there aren't people and they should just stop, tell them this. Say, okay, do you know someone who's obese or has type 2 diabetes? If they go, yeah, be like, okay, so you hate them then, right? And you see them the same way? And they'll go, no, that's my father. And you'll go, so they suffer from addiction of sugar then. And they're going to go, well, yes, he's suffering. It's not his fault. Like, yeah, now imagine heroin. That's actually 10 times more addictive. There you go. Same with nicotine, right? So if anyone doesn't understand addiction, just look at diabetes. Type 2, by the way. type 1 you can get from birth, genetics, but if you get type 2 later in life and you don't have pancreatic cancer, then it's usually from overuse of carbs and sugar. Even heart attacks now, we found with new research that it's not meats and fats. It's trans fats, yes, but also sugar that's creating bacteria in the gut that's releasing plaque in the blood. So cut down on the sugar and carbs, people, and you're going to realize a drop in obesity, type 2 diabetes, and heart disease. So it's another little thing. Addiction can go into food. It can go into
totally
socially acceptable stuff like caffeine. You know, you can.
I mean, if you're talking
problems.
about addictions in general, too. I mean, you could even look outside of substances and look at technology addiction, gaming addiction, sex addiction, like gambling and all that stuff as well.
You're gonna love this. We had a memo had to go out when I was a paramedic in Halifax, specifically, right in the city. We had a memo come out that was titled "Pokemon No." Now listen, it was paramedics in uniform pulling up to notably Pokemon populated areas, jumping out of the ambulance, catching Pokemon in uniform, and the public being like, what the fuck? And sending in complaints. And also on the way to calls, people would be in the passenger seat catching all the Pokemon on the way to a call because you're driving fast through all the checkpoints. So they sent out a memo saying, guys, no Pokemon Go while you're on duty. And they had to put a special bonus point saying, especially when you're on a call, don't go into a patient's backyard and be like, so his breathing's getting good. Now listen, you got a Pikachu in your hot tub. Can I just quickly snag that and then we'll get him on the stretcher?
Oh my God.
That is awesome.
That's technology addiction, right?
Yeah.
It's beautiful to see that it's everywhere. Patients to texting. I had this chick. She had a deep slice from a plate that broke that nicked an artery, so deadly bleed. We were able to stop it. But on the way to the hospital, with the wrapped up arm, she kept texting, playing Candy Crush on Snapchat. So on my form, I'm like, well, all I have to write on my form is her hand's fucking fine because she's texting. So the doctor's like, what's your neurological assessment? I'm like, she's texting. She's fine. So, you know. But maybe it's helping her with the pain, right? Because there it is. It's stimulating her dopamine system. So I don't have to give her any pain meds now. Great.
Right. At the very least, it's a wild distraction.
Right. Just like morphine. Morphine doesn't take away the pain, people. It gets you high and you don't care about it.
Right. So we're at about time, Jake. So let's send people your way. You're soon to have your own podcast, Flights of the Mind. Is that right?
It's actually Flight of Thoughts because I wanted to make it more, which isn't bad. I like Flights of the Mind, actually. That'd be a cool spinoff. No, I like Flight of Thoughts because it's that symptom that people get confused. It's not always psychosis. We all get flight of thoughts. I also tend to talk that way because I have ADHD. So yes, it's the Flight of Thoughts podcast. It's going to be releasing in the next 2 weeks. I'm going to try to get an episode out every couple of weeks. So awesome. Please follow on Instagram, Jake_Flight of Thoughts for more information on that. Also on Facebook, we have the Psychedelic Society of First Responders and Emergency Workers, and that's where you can get information on our psychedelic harm reduction workshops in Toronto. If you're a first responder or even a healthcare worker in general that uses psychedelics or cannabis and you want support and information and you want to feel less stigmatic about it and meet other people that use them as well or support it, you can follow our page.
Awesome. Jake, thank you for joining us and really look forward to working with you further. It's going to be a fun ride to watch your development here. So
you guys,
talk soon.
Thanks so much. Thank you guys. Take care.
Thanks, Jake.
Hope you enjoyed that episode. Jake Mitchell, Flight of Thoughts podcast. Check it out. He's a brilliant guy. He's going to be around for a while and is extraordinarily active. Really excited about his influence on Toronto long term. And just excited. So if you want to support the show again, leave us some messages on Facebook, iTunes. Check out what we've got going on at psychedelicstoday.com. Got shorts, t-shirts, cups, shower curtains, all sorts of other fun stuff. So check that out. We've got classes, navigating psychedelics, like I talked about earlier. So a lot of ways for you to help us out. You could even become a patron. Leave us $2 a month over at patreon.com/psychedelics today. We would love that. Really helps us out a ton. This project is expensive and we've got a team working with us now. So please help us bring you more value. All we want to do is bring you more. And if you want to contribute and help us out, please do. We'd love it. And maybe if you got some special skills that you want to donate, feel free to hit us up, Psychedelics Today, email@gmail.com. We'd love to take anything we can get. And I don't know that I've ever talked about this on the show, but we do accept cryptocurrencies. So our shop is enabled with crypto. I don't think our Teachable, like our course platform, allows it, but we could, if you want to, just let us know that you want to buy it with crypto, and we can make that happen. So thanks a lot. Hope you enjoyed the show, and until next time, this is Joe Moore signing off from the Psychedelics Today.